there are no objections, the minutes from the last meeting stand approved. Hearing no objections, the minutes are approved. We have a series of presentations today, I'm happy to report, from Iowans who suffer from debilitating medical conditions that have come here today to share their stories with us, and I want to thank them in advance for the courage they show in being here today. I think they were here at the previous meeting under Senator Mathis, the Human Resources Committee, and I can tell you their testimony it borders on heartbreak. And so I guess we'll start with Jeri Goodell. Jeri, introduce yourselves, tell us where you're from, and go ahead.
Thank you so much for having me here today. Thank you, Senator Bogum. I'm Jeri Goodell. I'm from Lake Park, Iowa, up in the northwest corner of Iowa. Senator Johnson represents me. I can tell you today that serious illness is a powerful motivator. Despite working as a nurse for over 20 years, I had little exposure to seizures and really no interest in medical cannabis. 3 years ago, the birth of our grandson Garrett changed all that. I suspected that we had a special boy the very first moment that I saw him. He had very subtle but unusual facial features. Garrett had a serious heart condition and was transferred to a larger hospital, and there we learned that he had a gene missing on his 7th chromosome. He had heart and cranial surgeries before he was 7 months old, and at the age of 1, he had an episode of respiratory arrest and unconsciousness. He was hospitalized for a few days with no answers. It was a stressful time taking him home. For a year, he was fine, and the stress of that first year was almost forgotten until a few months after his 2nd birthday, when the seizures began and became much more frequent. We got to know the ambulance crews, ER doctors, and the staff at 3 hospitals, Sioux Falls, South Dakota, Omaha Children's, and the St. Paul Epilepsy Center. It took almost a year for the doctors to diagnose Garrett with intractable epilepsy. He is on a combination of 3 anti-epileptic drugs. These medicines can be very toxic to the liver and the kidneys, and so routine blood tests are just part of his life. Each medication comes with a long list of adverse side effects and the suicide warning, which explains that taking these medications increase the risk of suicidal behavior comes with almost all of them. Parents with epilepsy rarely get a break. They can't hire a babysitter and go out for dinner. They never know what a new day will bring, and they must always be ready to administer rescue drugs. For thousands of years, cannabis has been used to treat a wide variety of ailments, and it is effective for controlling seizures in many patients. During the 1930s, at least 27 medicines containing cannabis were widely available in the United States and widely used. The Marijuana Tax Act of 1937 prohibited marijuana, even though Dr. Woodward, president of the American Medical Association, testified that this law would prevent the medical use of marijuana, which it did. At the time of the Controlled Substance Act in 1970, cannabis had been prohibited 30 years, and its medical use is forgotten. And it was at that time categorized as a Schedule I drug. The definition of a Schedule I drug simply does not apply to cannabis. There are approximately 100 different active components in cannabis. They are called cannabinoids. Each one of those cannabinoids serves a different function in the human body, and the science is exploding. Our body is set up with what is called an endocannabinoid system. It's almost as if God made this plant to help our body in illness. I can't explain everything that goes along with that, but I have been learning and am amazed at that system in the body. We contain receptors that are sensitive to these elements in the cannabis plant that can help us with many health conditions. Legislatures have convened in 45 states in the last 40 days, and cannabis policy reform bills will be considered in more than half of them. Bills to legalize medical cannabis have been proposed in 12 states and are anticipated in 6 others. 10 states are considering proposals to decriminalize possession, much like you all did last year. And 5 more are expected to follow suit. I have followed the development of the Minnesota Department of Health medical cannabis program. I live quite close to Minnesota. And I have attended meetings of the Medical Cannabis Task Force, along with meetings for the prospective grower, producer, distributors also. Our neighbors in Minnesota have implemented their plan very quickly and efficiently. A safe and consistent medication will be ready for Minnesotans by July 1st. I know Senator Johnson in our last meeting had questions about that, but one look at the State Department of Health website will tell you where they are. And because I live close to Minnesota, I just haven't answered a survey, but Minnesota Department of Health right now is surveying potential patients so that they have an idea about the amount of medication that they'll be needing. Today, Garrett's parents have 3 options, They can continue giving him the medications he's taking now, hope that they continue to produce fair control and do not lead to serious damage to his body. They could move to Minnesota, where a safe, consistent medication will be available on July 1st. My daughter-in-law, Toby, owns her own business in Iowa and has been a very successful young entrepreneur. My son actually has 3 jobs and works very hard. They love living in Iowa and have done very well as young people in our state. The third option that they could have is they could illegally obtain cannabis. That product may be contaminated or altered. And of course, they could get into legal trouble. I'm asking all of you to develop a program in Iowa that would provide a safe, consistent source of medical cannabis, not only for Garrett, but for all other Iowans with serious illnesses. I thank you very much.
Thank you. Brandon?
Good afternoon. Thank you for your time today. My name is Brandon Brase. I was born and raised in Waverly, Iowa. I've lived in Iowa all 31 years of my life. I have a beautiful wife, Laura, and 2 young children, William and Isabel. I graduated from Waverly Shell Rock High School and went on to get my associate's in applied science degree in police science from Hawkeye Community College. I'm currently working for Fairway as an assistant meat manager in the meat department. I've been with the company for 13 years. I've been diagnosed with having moderate to severe Crohn's disease, which is an autoimmune disease that causes inflammation throughout my digestive tract. In 2009, after years of suffering through different symptoms, including rapid weight loss of over 30 pounds, blood in my stool and vomit, ulcers in my stomach, and incredible abdomen pain, after seeing many doctors and finally being sent to a GI specialist in Cedar Rapids, I was diagnosed. Since that time, I've been on every single FDA-approved medication. All of them have failed me. All of them have terrible side effects, including liver damage, increased chances of cancer, and the risk of brain infections. One of the medications is even a pregnancy X drug. While taking these medications, I've been hospitalized numerous times. In 2012, while on Remicade, one of the drugs that has failed me, I was diagnosed with a small bowel obstruction and was given a nasogastric tube at my local hospital. The tube was there to remove liquids from my stomach to stop me from vomiting, which was occurring every 10 minutes. I was then taken by ambulance to Mayo Clinic, where I had surgery to remove part of my small intestine and had a colostomy bag put on. 8 weeks later, they removed the bag when I had healed internally. I've missed work, family events, and time together with my kids because of these surgeries and hospitalizations. The stress my wife goes through at home, having to become a single parent while her husband is hospitalized, is something that she shouldn't have to deal with. Having to answer the questions from our 2 and 4-year-olds. Why is Daddy in the hospital again? When can he come home? Is he going to be okay? Not to mention the financial burden of all the medications and hospital bills put on my family. Currently waiting on my insurance company to approve the last FDA-approved drug for my disease, Entyvio. The FDA approved it for use last May. Currently, there's nothing preventing the inflammation from coming back until the insurance says that I can start Entyvio. You may ask why I'm not on this drug yet. I was told because the cost is over $18,000 a treatment, and there's a high risk of brain infection. My nurses tell me they go back and forth with insurance companies over this, and it could take months to get approved. Meanwhile, I spent the last part of last week through this morning in the hospital because inflammation and recurring abdomen pain had returned. Ulcers in my small bowel had caused it to become obstructed again. I spent Valentine's Day in the hospital bed instead of enjoying it with my wife. If Entyvio fails me like all the previous ones have, I will have to have more surgeries and be put on disability and no longer be able to support my family. But there is one more thing that has been shown to put my disease into complete remission 45% of the time, according to studies. Cannabis oil. I'm talking about medical grade marijuana, not recreational. The cannabis oil I need for my Crohn's disease has higher levels of CBDs in it. Never have I thought in my life that that would be an option for me. But if this last drug fails me, I have no other options other than a life of pain and surgeries. 23 other states have medical marijuana laws and more in the process as we speak. It's been shown to help people with my condition and others facing their own medical conditions with no known side effects and very little cost compared to the prescription drugs I'm currently taking. Minnesota will start their program in July of this year, and I'm asking why aren't Iowans given the same option? The Surgeon General just gave medical marijuana a big boost a few weeks ago, saying we have some preliminary data showing that certain medical conditions and symptoms can be helpful with this oil and marijuana. I've emailed some of our legislators and talked with some of them face-to-face here at the Capitol. Some of them have told me they support medical marijuana, as do 80% of Iowans, according to a study done by the Quinnipiac University. Others have told me that Iowans don't want to pay the expenses to open dispensaries for the cannabis oil or to grow it interstate. but state medical marijuana programs have generally had no trouble covering their expenses and even generated substantial surpluses. In Michigan, Oregon, and Arizona, patient registry programs, dispensary regulation programs, or both have brought in millions of dollars in surpluses. In Colorado alone, the annual local tax revenue from just medical marijuana businesses alone exceeds $11 million. Some legislators even told me I was holding on to false hope, that cannabis oil is a false hope of being cured. But I ask you, what prescription drug is 100% guarantee of being cured? Aren't all medications a glimmer of hope to a cure patient? Why not give Iowans the same chance at medical cannabis that other states have given their citizens with overwhelming success? Why let Iowans fall behind and suffer when other Americans are being treated in neighboring states? I was told by some of the legislators to move to that state that allows it medically. But why should I have to pick up my family and leave my job of 13 years from my home state of Iowa because our legislation can't agree on what most half of the other states agree on?